Step-by-step guide on how to perform CPR correctly on an adult. Performing CPR, cardiopulmonary resuscitation, can be a life-saving skill in emergency situations. Here's a step-by-step guide on how to perform CPR correctly on an adult. Step 1. Assess the scene and ensure the area is safe for both you and the victim. Look for any potential hazards or dangers. If it's safe, approach the person who appears unresponsive. Step 2. Check for responsiveness. Gently tap the person and shout, "Are you okay?" If there is no response, the person is unresponsive, and you should assume they need CPR. Step 3. Call for help if you're alone, or there's no one else around. Call 911, or your local emergency number, immediately. If there's someone nearby, ask them to call for help while you begin CPR. Step 4. Check for breathing. Kneel down beside the person and look for signs of normal breathing, chest rising and falling. If they are not breathing or are only gasping, it's time to start CPR. Step 5. Perform chest compressions. Place the heel of one hand on the center of the person's chest, just below the nipple line. Place your other hand on top of the first hand, interlocking your fingers. 1. Position yourself with your shoulders directly above your hands. 2. Keep your arms straight and your fingers off the chest. 3. Use your upper body weight to push down hard and fast, at least 2 inches, 5 centimeters, deep, and at a rate of 100,120 compressions per minute. 3. Think of the beat of the song, "Stayin' Alive," by the Bee Gees as a helpful rhythm to follow. Step 6. Give rescue breaths, if trained, after 30 chest compressions. If you're trained in CPR and comfortable giving rescue breaths, you can perform them. Tilt the person's head back slightly, pinch their nose shut, and give 2 rescue breaths, each lasting about 1 second, until the chest visibly rises. Continue with cycles of 30 compressions and 2 breaths. Step 7. Continue CPR. Keep performing cycles of 30 compressions followed by 2 breaths, if trained, until one of the following happens. 1. The person starts breathing on their own. 2. Professional help arrives and takes over. 3. You are too exhausted to continue. Step 8. Use an automated external defibrillator, AED. If an AED is available, follow the device's instructions. Attach the AED pads to the person's chest and follow the prompts provided by the AED. Important notes. Push hard and fast during chest compressions. Adequate depth and rate are crucial for effective CPR. If you are not trained in CPR or are uncomfortable giving rescue breaths, it's still beneficial to perform hands-on CPR, chest compressions only. Remember that quick action and chest compressions are critical to maintaining blood flow to the brain and other vital organs during cardiac arrest. It's highly recommended to take a CPR certification course to gain hands-on experience and be better prepared to respond to emergencies effectively. For more videos, don't forget to like, share and subscribe.